Hello friends, today we are going to learn about new modalities in healthcare profession. Since times immemorial, the field of medicine has always been dynamic and ever changing. Every century, every decade brings with itself remarkable revolutions in all the fields of science. Medicine also is subjected to various advancements and reforms due to advent of extensive evidence-based research and technological boom. In this presentation, we are going to learn about the evolution of medicine and the revolution in the field of medicine obtained through digital therapeutics, artificial intelligence, robotics, precision medicine, personalized medicine, integrative medicine, nanomedicine, simulation based learning, 3D printing, virtual reality, genome sequences, advances in the drug research, emerging specialties in the field of medicine, and advances in the field of Ayurveda after the advent of artificial intelligence. The medicine evolved in the form of Ayurveda about 3000 years ago, followed by the many branches of medicine like traditional Chinese medicine, ancient Greek medicine, homeopathy, naturopathy, hydrotherapy, chiropractics, osteopathy, and which led to the recent emergence of conventional medicine. So, artificial intelligence is the milestone of the new era of medicine. So, it is the result of advent of the technological advancements in the field of science and data mining. The invention of apps, healthcare trackers, wearables, sensors, diagnostic machines, interventional surgical devices are some examples of artificial intelligence in healthcare. The patient information is managed and stored in the form of data, which is further processed for statistical analysis and generating the evidence. This has also resulted in the digital therapeutics. For example, there is an hospital in United States of America which calls itself an hospital with no beds. All the patients are managed virtually via telehealth based approaches. Recently, Niti Aayog and MCI released telemedicine practice guidelines which enabled a telemedicine practice during lockdown where human intervention was not possible. So, telemedicine, telehealth, and e medicine is the remote delivery of healthcare services, including exams and consultations over the telecommunications infrastructure. Telemedicine, a term coined in 1917, literally means healing at a distance and signifies the use of ICT to improve patient outcomes by increasing access to care and medical information, and is also propagated by World Health Organization. Robotics is certainly the future of healthcare, wherein the robotic surgeries are gaining popularity day by day. It has an application in the COVID like conditions where the human communication or human intervention is at stake. It is of great use in emergency care and also in the field of prosthetics and rehabilitation. Precision medicine or tailor made medicine is another advancement in the field of medicine wherein the tailoring of medical treatment to the individual characteristic of each patient is done. It classifies the individuals into subpopulation that differ into susceptibility to a particular disease or even the response to a particular treatment. So every individual will respond to a certain condition in its own individualized way and also will respond to the therapeutics in according to one's susceptibility. So the preventive or therapeutic interventions are concentrated on those who will benefit, sparing expense and side effects for those who won't benefit from the particular uh, drug. So the databases will be curated on the base of these health records and leading to the evidence-based research outcomes which will further propagate the use of precision medicine. It describes a model for healthcare delivery that relies on data, analytics, and information which is harnessed through the artificial intelligence itself. Personalized medicine or the individualized healthcare is another branch which is a therapeutic approach involving the use of individuals' genetic and epigenetic information to tailor the drug therapy or preventive care. So, this involves the Prakriti based understanding of patient physiology and pathology and incorporates the basic principle of Ayurveda and the concept of Purusham Viksha, which is important in healthcare. So, it is multidimensional, multidisciplinary approach and holistic approach that has been incorporated by Ayurveda since many traditions. Integrated medicine or integrative medicine is another field which is practicing medicine in a way that selectively incorporates the elements of complementary and alternative medicine into comprehensive treatment plans alongside the orthodox or conventional methods of diagnosis and treatment. So it is bringing together the best of both worlds, that is of the conventional medicine and the traditional medicine. The incorporation of principles of holism and simple methods of intervention, dietary adjustments, relaxation techniques, which are prominent in alternative medicines like Ayurveda, are also provided along with the conventional therapy to give holistic benefit to the patient. Nanomedicine is again gaining great popularity in today's era, which involves the tools for the investigation, manipulation, and control of atoms, molecules, and submicroscopic objects, generally ranging from 1 to 100 nanometers. So, it has its application in diagnostics, in medical imaging, in neurotherapeutics, in the production of vaccines, and in regenerative medicine through the production of biomaterials. So it is the convergence of nanotechnology and medicine leading to interdisciplinary field of nanomedicine, which also incorporates the Ayurveda principles of Bhasma, which are continuously in use for the treatment of many asadhya vyadhi. Simulation based learning or simulation based training is the educational activity that utilizes the simulation aids to replicate the clinical scenarios. So, it is a situation in which a particular set of conditions is created artificially in order to study or experience something that is possible in real life. So, we train the budding doctors in the real life experiences of managing a patient before they enter into the field. So, it is a generic term that refers to the artificial representation of real world process to achieve educational goals via experimental learning, which is also navigated through the use of artificial intelligence and machine learning. 3D printing is another milestone in surgical field, which are highly accurate and customized reproductions obtained from own radiological imaging of patients, which are solid graspable objects allowing for free manipulation on the part of users. So, this technology is applicable in reconstruction surgeries, in vascular surgeries, in organ donations and implants, further providing a way in the revolutionizing the plastic surgeries. Virtual reality is another part that helps in revolutionizing the field of medical education as well as patient care. For example, in palliative healthcare settings, a patient in pain can be put on virtual reality headset and he can escape into virtual world, aiding in elevation of the pain. Similarly, we can apply this concept for psychological counseling in a depressed patient. For medical school students, it can simulate a surgical environment and practice before a student becomes a doctor and enters the OR. So, this virtual reality is applicable in the treatment of cancer, mental health disorders as a part of diagnostic techniques and a part of learning and teaching methodology in medicine. Advancement in genome sequences. The Human Genome Project has led to revolutionized healthcare through the harnessing of the genetic based data and management of the diseases at the gene level itself. So, this genome sequencing is especially useful in the assessment and management of hereditary diseases, in reproductive health, in cancer susceptibility, in cancer prognosis, and even cancer treatment, in understanding the epigenetic changes that occur in physiology and pathology, and also in the field of gene therapy. Advancement in drug research is also brought about after the popularization of artificial intelligence, where gene target based drug delivery system is important for bringing about the minute healthcare delivery in the treatment of various diseases. Similarly, the techniques like transcriptome and RNA sequencing is important for developing different drugs, and network pharmacology based approach or molecular docking is also important for understanding the mechanism of action of Ayurveda drugs. Other specialties like mind coaching or mindset coaching, epigenetic counseling, and microbiome specialist are emerging specialties which also make use of sophisticated technology to understand the deeper pathologies for treatment of any kind of disease, and these are the specialties that we have to look out in the future. Ayurveda has always been open to new advances that take place in the conventional and interdisciplinary fields. So, the concept of Ayurgenomics or e-Sanjeevani OPD or Nutrigenomics is the example of integration of artificial intelligence in the field of Ayurveda. The Ministry of Ayush has also established the Ayush grid to incorporate the technological advancement in better understanding of the classical Ayurveda as well as promoting the advances in the field of diagnostics and therapeutics as per Ayurveda. However, in spite of all the technological advances and artificial intelligence, the human contact and the personal connection of a doctor and a patient leading to the healthy doctor patient relationship stands of the utmost importance, and one should always take physical examination and diagnosis into consideration while treating every human. Thank you so much for patient listening and keep learning. Thank you.